Anixter Center was founded as an orphanage for children who lost their parents in the influenza epidemic of 1918. Throughout the years, we've evolved, broadened our focus, and developed new programs and services in direct response to our community's changing needs. Our mission is to provide an array of services and supports to people with disabilities and related challenges to live, learn, work, and play in the community. 90% of our program participants are low income. Without Anixter Center, they'd have few, if any, places to turn. We've been a vital part of Chicago's continuum of care for nearly a century, and we will remain steadfast in our dedication to help all people in need. Anixter Center provides a range of targeted services to help people with disabilities and related challenges reach their full potential. Through 34 specialized programs, Anixter Center serves 7,400 children, teens, and adults annually. Our programs focus on education, housing, employment, health and community support services, areas that are essential to all of us, but are developed in ways that address the unique needs of people with disabilities. When you invest in Anixter Center, you can be sure that you're making a meaningful and lasting impact on people's lives. Anixter Center has an enduring and well-respected history of effectively responding to the needs of the community. As such, we're uniquely positioned to provide innovative, individualized programs that focus on the person as a whole, rather than just their disabilities. At Anixter Center, we connect program participants to the power and ability to take control of their lives. Our dedicated team of professionals truly care and believe in each person's potential to thrive. Once our program participants realize and own their power, they're unstoppable. And as they rise, we become a better, stronger community. We maintain an unwavering commitment to our mission. Every staff person, organization leader, board member, volunteer, and community partner understands and shares our passion and vision. Though provisions may change, our purpose remains clear, giving us great strength as we carry our mission forward. We have a thorough process of evaluation that tracks the success of each program against annual goals, outcomes, and other indicators, and helps us shape our future. We know we're accomplishing our goals when we demonstrate a culture of continuous quality improvement, when we're perceived as a diverse and dynamic learning organization that enriches the disability field locally and nationally, and when we have laid a diversified and more stable foundation for future growth. Anixter Center stands out as one of a few organizations that effectively addresses the comprehensive spectrum of needs of people with disabilities. In addition to the disabilities that the general public most commonly sees, we offer unique programs such as social services, advocacy, and support programs for people who are deaf or hard of hearing, programs for people who have suffered traumatic brain injury, programs and services specifically geared towards the needs of Latinos and people of all colors impacted by HIV and AIDS, and services to improve the lives of children with special needs through the utilization of toys and play. We created the first and only Chicago area literacy program that focuses on the unique needs of individuals with disabilities. We developed Chicago's first and only domestic violence program, designed specifically for people who are deaf or hard of hearing. Our outpatient substance abuse treatment services are the first of their kind in Illinois, and we've improved the lives of young children through cutting-edge programs that use toys and play to provide them with an understanding of and the ability to relate to the world around them. Because of the way the most recent recession affected government funding, particularly in Illinois, Anixter Center must find new and creative ways to sustain and build our programs. Historically, we've been so laser-focused on our programs that we haven't been effective at communicating our stories and successes. However, Now we're making new investments in getting the word out about the great work we do. Additional resources would enable us to continue strengthening the quality of our services, revitalize important programs that had to be cut due to the lack of funding, and increase the number of programs we provide to continue meeting the ever-changing needs of people with disabilities. At Anixter Center, we keep our hand on the pulse of the community so we can fill gaps in Chicago's social services. We could develop and implement a variety of innovative programs, such as domestic violence prevention for deaf youth, new programs that address the specific needs of women with disabilities, and specialized services for returning veterans.